Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority. Welcome to our latest Let's Talk Mental Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. Thank you for joining us. Now, mental health is a universal human right. By prioritizing your mental well-being, you can improve your quality of life, manage stress, build resilience, and maintain healthy relationships. To help you take control of your mental health and well-being, STHS Behavioral hosts these monthly Let's Talk Mental Health webinars. By offering important education, more people will hopefully feel comfortable talking about their own mental health challenges and seek professional help if necessary. Now, in this installment, we'll be discussing bipolar disorder. Sometimes referred to as manic-depressive disorder, bipolar disorder is a mental illness that causes dramatic shifts in mood, energy, and activity levels, which can affect a person's ability to conduct day-to-day tasks. Every year, nearly 3% of the U.S. adult population is diagnosed with bipolar disorder per the National Alliance on Mental Illness, with a majority of those diagnosed between the ages of 18 and 29. Now, bipolar disorder is treatable through medications like mood stabilizers, antipsychotics, and sometimes antidepressants. Along with medication, a mental health expert may suggest counseling and support groups. So what causes bipolar disorder? What are the common signs and symptoms? And what are the complications associated with untreated bipolar disorder? Well, today we're joined by Kevin Trussell, the Director of Nursing at STHS Behavioral, with all of those answers and more. Kevin, thank you so much for joining us.
Thank you. Nice to be here.
Now, worldwide, bipolar disorder affects about 40 million people. Is it something that we see commonly here in the Rio Grande Valley?
Yeah, it's actually one of the leading causes of, for example, admissions for inpatient treatment to the facility where I work. And so usually untreated, non-compliant with treatment as an outpatient. And so, yes, you do see quite a bit of it in my line of work. Now,
obviously, you are in the hospital setting. You see patients come in every day, is that right?
Yes.
And in what condition do you see them coming in?
Most of the time, it's when they're experiencing severe depression. There have been active suicidal thoughts, perhaps an even suicide attempt. But we do occasionally get those patients in that are in an extreme manic phase, and which can be just as debilitating to their lifestyle as would be if they're severely depressed.
And when we're talking about it, we're talking about extremes. You're talking about a really high and a really low.
Right.
And so can you tell us a little bit about what are some of the things that you see with that euphoria sort of state that you see?
It's interesting because some of the patients that come in have displayed aggressive behavior to the point that they're making threats toward friends, family members, even out in public places. There's also times where you see that manic behavior burning through life savings, making extravagant expenses where the family's bank account has been drained because of that manic behavior. And then just, you know, sometimes there's drug abuse, alcohol abuse that's associated with that. And some of the drugs that they choose to use, for example, cocaine, can really kind of exacerbate those symptoms.
Now, obviously, when they come to the hospital, they are in that sort of crisis state. So they're coming to you, they need crisis help or dealing with more of an emergency setting for that condition. But when it comes to day-to-day, is this something that people recognize? Is it something that is sort of misunderstood, or do people know bipolar disorder, oh, I may have it, or my loved one may have it?
I think that there are quite a few knowledge deficits, as we say, when it comes to mental health in general. Bipolar disorder definitely being one of those. And so some people may overlook some of the symptoms or attribute them to other things. And once again, nobody wants to feel like they're being labeled as having a mental illness, and so a lot of times they will kind of overlook those things because they don't want to admit that they themselves have an issue. They don't want to admit maybe that a loved one has a mental health issue as well.
Now, obviously, education is extremely important when understanding mental health issues. And so you have a great presentation for us that has a lot of information that I think will benefit the community. So let's get started.
Great. So the reason I chose bipolar disorder for this month's presentation is because March 30th is when we have World Bipolar Day. And so they chose March 30th because it's the birthday of famous artist Vincent van Gogh. And Tom, you may remember from art history class that Vincent van Gogh famously cut his ear off. He had a major blow up with a friend or acquaintance of his and got so enraged that he took a razor and he cut his ear. And so that and other facts from his life led them to posthumously kind of diagnose him with bipolar disorder. So to draw awareness to bipolar conditions and to eliminate the social stigma related to bipolar disorder, they set up World Bipolar Day every March 30th. So go into a little bit about what bipolar disorder is. Bipolar disorder obviously is a mental illness causing dramatic shifts in a person's mood, energy, and their ability to think clearly. People with bipolar disorder experience high and low moods known as mania and depression, which are different from the typical ups and downs that most people experience. The average age of onset is about 25 years old, but it can occur in teens or even less commonly in childhood. Bipolar disorder affects men and women equally. Approximately 2.8% of the US population has been diagnosed with bipolar disorder, of which almost 83% are classified as severe. Without treatment, bipolar disorder usually becomes worse. However, with a good treatment plan, including psychotherapy, medications, a healthy lifestyle, a regular schedule, and early identification of symptoms, many people live well with the condition. The symptoms of bipolar disorder kind of generally are dramatic mood swings from overly high and or irritable to sad and hopeless and then back again, often with periods of quote-unquote normal mood in between. Severe changes in attention, behavior, and energy are characteristics of bipolar disorder. The periods of highs are called manic episodes. The low periods are called depressive episodes. And you mentioned in your introduction about how it's also been referred to in the past as manic depression, and that's kind of where that comes from. So when you have a mild to moderate level of mania, that's called hypomania. And that may feel good, could be associated with good functioning and enhanced productivity. In this one, family and friends might not recognize the mood swings, but they might recognize the mood swings, but the person might not realize that anything is wrong. Severe episodes of mania or depression can include psychosis. The person may show signs of being out of touch with reality. They may experience hallucinations, such as seeing things, hearing things, or otherwise sensing the presence of things not actually there, and delusions, which are false, strongly held beliefs that are not influenced by logical reasoning or explained by a person's usual cultural concepts. And you do see this a lot of times mistaken for schizophrenia, for example. And we've had patients that in the past have experienced these delusions of grandeur. In other words, they feel like they overestimate their powers, or they feel like that they are, I'm in charge of this hospital, I own this hospital, and you're fired, you know? And so you do see a lot of those really off the wall, sometimes delusions. And some other symptoms of mania include an increased energy level, activity or restlessness, an excessively high euphoric mood, extreme irritability, the smallest thing will set them off, racing thoughts, rapid speech, jumping from one idea to another, distractibility, difficulty concentrating. Little sleep is needed. They'll sometimes tell you that they've gone 36, 48 hours, even longer with no sleep whatsoever. unrealistic beliefs in one's abilities and powers. Like, I could jump off this 3-story building and nothing would happen to me, something like that. Poor judgment, spending sprees, a lasting period of behavior that is different from usual for them, an increased sex drive, again, drug abuse, particularly cocaine, alcohol, and sleeping medications, provocative, intrusive, or aggressive behavior, and a denial that anything is wrong. So to diagnose somebody with a manic episode, there needs to be an elevated mood with 3 or more of the other symptoms that I mentioned for most of the day, nearly every day for 1 week or longer. Or an irritable mood with 4 additional symptoms that I described present. So again, looking at mania, becoming overly elated and energetic, becoming more irritable, requiring less sleep, racing thoughts, somebody talking very quickly, making grand plans, may believe that they have supernatural powers or they're on a special mission, and may impulsively engage in potentially dangerous behavior. The opposite of that, when you are in a depressive episode, some of those symptoms include poor appetite or overeating, trouble sleeping or sleeping too much, nervousness and worry, a loss of interest in and a withdrawal from usual activities, things that you typically find enjoyment in, feelings of sadness that don't go away, irritability or restlessness, a lack of energy, feelings of sadness, worthlessness, or guilt, inability to think or to concentrate, repeated thoughts of death or suicide, chronic pain or other physical problems that don't respond to treatment, and increased risk-taking behavior, including reckless driving or substance abuse. So when depressed, a person with bipolar disorder feels persistently sad, hopeless, suicidal, experience disturbances in their sleep and their appetite. They feel lethargic. They may feel excessively guilty, may feel negative about everything. So what causes bipolar disorder? Research on potential possible causes of the disease continues, but scientists agree that there's no single cause for bipolar disorder. Instead, it's believed that many factors act together to produce the illness. Genetics is a big part of that. Bipolar disorder tends to run in families, and studies suggest that many different genes act together and in combination with other factors cause bipolar disorder. Because it appears that each gene that contributes to this only contributes a small amount toward making someone vulnerable to bipolar disorder, identifying them has been very difficult so far. There have been studies where they do brain imaging studies like MRIs, PET scans. Those allow researchers to study the living brain at work without having to do surgery or other invasive procedures. Evidence from these imaging studies shows that the brains of people with bipolar disorder may differ from the brains of healthy individuals. Through additional research, a better understanding of bipolar disorder's underlying causes will be possible and may lead to the ability to predict which types of treatment will work most effectively for a certain individual. The course of bipolar disorder, you'll see episodes of mania and depression that typically repeat across an individual's lifespan. Between these episodes, most people are free from symptoms, but about a third of them, 33%, have some residual symptoms. The first form of bipolar disorder is bipolar I disorder. This is the classic form of bipolar disorder. Recurrent episodes of mania and depression, the roller coaster, if you will. Bipolar II disorder, some people with bipolar disorder never develop that severe mania. Instead, they experience milder episodes of what we call hypomania that alternate with depression. And then there's something called cyclothymia, which is a chronically unstable mood state in which people experience hypomania or mild depression for at least 2 years. They might have brief episodes of normal mood, but these last less than 8 weeks. So they spend the majority of their lives in some form of a hypomanic state or a depressed state. There's also something called rapid cycling bipolar disorder. This is classified as 4 or more episodes of the illness within a 12-month period. Some people can even experience multiple episodes within a single week or even a single day. Rapid cycling tends to occur later in the course of the illness and is more common with women than men. Oops. How is bipolar disorder treated? So you've got the treatment and management of bipolar disorder. Several different methods are involved in the treatment. You've got medications, which, as you mentioned earlier, may include mood stabilizers, antipsychotic medications, and to a lesser extent, antidepressants. Psychotherapy, there are different types of therapy. Some are cognitive behavioral therapy, or CBT, dialectical behavioral therapy, or DBT, and family-focused therapy. Education, as you mentioned, is a really important part of this. For an individual to get a better knowledge of the illness can lead to more effective management of the symptoms and prevention of complications. Lifestyle management is also important. Careful regulation of one's lifestyle to keep symptoms and episodes to a minimum. Examples of this might be keeping a regular sleep schedule, avoiding drugs and alcohol, consistent exercise, minimizing stress, and even keeping sunlight exposure stable year-round. And finally, support. Family and friends are an invaluable resource of support. Additionally, participating in a bipolar disorder support group could be helpful. What about coping with bipolar disorder? You've been diagnosed. How do you cope with this? Get treatment and stick with it. Treatment is the best way to start feeling better. Keeping your medical and your therapy appointments and talking with your healthcare provider about treatment options. Obviously, taking your medications as directed. Structuring activities in your life. Keep a routine for eating, sleeping, exercising. Try regular vigorous exercise like jogging, swimming, bicycling. This can help with depression and anxiety. It promotes better sleep, and it's healthy for your heart and your brain. Keeping a life chart so that you can recognize your mood swings, because sometimes you may not even realize you're starting to slip towards one extreme or the other. Asking for help when trying to stick with your treatment. And lastly, just be patient. Improvement takes time. Social support helps. If you have a friend or a loved one with bipolar disorder, there's things that you can do to help support them as well. First of all, just take a deep breath. Finding out someone that you care about has any illness can be scary. Have patience, be understanding of these mood episodes, these mood swings. Encourage the individual to talk about what's going on. And when you do, listen without judgment. Encourage the individual to continue doing activities that they have found enjoyable in the past. Support their treatment. Encourage them to stick with treatment. Remind them that it can improve their life. Monitor their symptoms and help them identify when they're getting worse, because they might not be aware of it. Encourage them to avoid drugs and alcohol. And if permitted, attend family or couples therapy. The person diagnosed with an illness often feels as if all the focus is placed on them. But larger family or system issues should not be neglected, because the diagnosis of bipolar disorder affects everyone. So getting back to World Bipolar Day, I thought I would share just some different areas that the viewers can go to on the internet. There's one that has different digital shareables you can post on different social media to help spread awareness of Bipolar Day. Again, March 30th, but definitely start building up to it. Post, especially if you or someone you know is dealing with bipolar disorder. And then for additional information, there is a website specifically dedicated to World Bipolar Day, which is www.worldbipolarday.org. If you or somebody that you know feels like their symptoms are spiraling out of control with feelings of hopelessness about life, worthlessness, thoughts of suicide, get help immediately. Call the National Suicide and Crisis Lifeline, which is 988 from any phone. Call a friend, call a loved one, call the hospital, call somebody. Reach out for help. If you need help, if you have questions, if you want to talk to somebody, you don't know who else to turn to, you can call our hospital anytime, 24 hours a day, 7 days a week, 956-388-1300. We're here, we're there to talk to you, we're there to provide support, suggestions, anything that anybody might need.
That is all really great information, and let's delve a little bit more into that, especially because I think, especially when you have somebody who you suspect may have bipolar disorder or does have it, being able to truly support them is really important. So let's talk first of all about who bipolar disorder affects. So it can affect anyone.
Yes.
So that's the one thing that we really have to know, that no one is immune from the potential threat of bipolar disorder.
Correct. And as I mentioned, if you have a family history of bipolar disorder, then the chances are greater that you could also have bipolar disorder. But men, women, equally affected. And as I mentioned, teenagers, even smaller children, can definitely be diagnosed with bipolar.
Mm-hmm. And the average age of onset is 25. So that's kind of in your 20s is when you should be really paying attention, anything leading up to that and around your 20s. But obviously, more rarely it can start as early as childhood or as late as your 40s or 50s. So even if you are getting into the older years, you still run that risk. But the 20s, is there any research that shows why it's that age, like kind of right around that age?
Not that I have seen personally. I'm sure that they've done research into trying to figure out if there's a correlation between that early adulthood.
And your brain kind of finally gets to that point right around the 20s, early 20s. So and maybe that has something to do with it.
Could be, and from personal experience, I've seen that sometimes you'll see teenagers who are starting to exhibit those signs.
Okay.
You'll see them easily triggered, angered easily, and then a little while later, the parents describe how they're just so negative about life, and everything just makes them extremely, sad and upset, to the point that they talk about dying and it's not worth being here and things like that. So you'll start to see those kind of cycles. Mm-hmm. Yeah.
And then bipolar disorder affects males and females in equal numbers. So it's not that you see it more in men or more in women. Right. You kind of see it equally, but it does tend to affect them differently. Is that right?
Well, you'll see, as I mentioned, if you talk about cyclothymia, for example, where the women tend to have more of that, because there's more of like this depression. And you don't quite hit that extreme high of the mania. You don't hit that extreme low. But I would say, in my experience, I've seen that and there may be some stereotype involved in this, but you tend to see males that are dealing with bipolar disorder might just, at least when they're in crisis, they get to the point where that mania really hits hard. And in females, the depression.
Okay. All right. Now, obviously, we talked about the causes. So you talked about genetics. So if you do have a relative that has been diagnosed with bipolar disorder, you really need to be paying attention to your life and looking for any possible signs. Are there any sort of warning signs that you can start picking up right away? Obviously, once you get to the symptoms, then you may have it. But are there any early warning signs that people will say, you know what, that's when I started noticing something?
I think the key is in the symptoms that I mentioned, because you'll have somebody, if they're experiencing that, for example, if they're going into hypomania, which is below that extreme mania, they feel really good. To them, nothing's wrong. But to somebody who knows them very well, who's spent a lot of time with them, they realize that they're acting just a little bit more, manic, if you will, than normal. Not to the extreme that it causes concern, maybe necessarily, but the person themselves is going to feel like, I feel great. I'm energetic. I'm going to go out. I'm going to go run my mile, and then I'm going to go work on this project. And they've got that energy where they're just going, and you know, it's in their mind, it's like, why would I want to leave this state? You know, I just feel like really, really good right now. But someone else, especially if they know that there might be that history in the family of bipolar disorder, might start looking to see, okay, after this, is there a cycle into kind of a depressive phase? And without treatment, bipolar disorder gets worse over time. And so you want to catch that as early as possible. And so being on the lookout for the list of symptoms that I mentioned earlier would be really important, because it's likely that a friend or a loved one's going to catch it before the individual does.
And when it comes to those mood swings, obviously you have the highs and the lows. What is the span in between them? Can it be rapid? Can it be weeks that you're dealing with it, or? Yeah,
it can. Typically, it's not going to be extreme rapid cycling.
Okay.
That rapid cycling that I mentioned in the different forms of bipolar disorder is not going to be the common version that you get of bipolar disorder. Bipolar 1 is your classic, and so you're going to see, you know, they'll have these cycles, but they'll have weeks in between where they feel normal, they feel themselves, but you start picking up on, man, there's always this pattern of, like, you know, they have this feeling really good, and then they go up, and then later they come down, and it's beyond the point of what you and I experience in life, where you just have good days, you have bad days. It's more than that.
Yeah. Now, let's talk a little bit about bipolar being a lifelong condition. So this is something that you are going to have to make sure that you're monitoring and treating your entire life if you're diagnosed
Correct.
with it. There's no cure, and there's no, I'm feeling better, I'm going to stop taking my medicine.
Unfortunately, that is what happens with a lot of patients, but to treat it, it is lifelong treatment. Adjustments are probably going to be necessary through the course of your life as you're treating bipolar, but you can't reach a point where you're going to say, okay, well, I'm done with meds, I've done my 6 months, and so I'm ready to go.
Now, obviously, I can understand, like, medication and being able to regulate, but how does talk therapy help when it comes to bipolar disorder?
Well, the medication obviously is working on the body itself, but learning to deal with those situations, for example, learning to deal with things that might be easy triggers for somebody, whether it be rage or whether it be sinking into a severe depression, learning to talk with a licensed therapist, someone who is an expert in doing this, is going to help you manage those things, learn to avoid certain triggers and situations that might kind of prompt you into a high or a low phase. And so it's real important to balance your medication therapy with your actual therapy with a therapist.
And also developing those coping skills. So yes, you avoid the triggers, but sometimes you can avoid a trigger.
Right.
And so you have to learn how to manage and deal. And so having that toolbox, as we always talk about, of coping skills that you can go to keep you level.
Yeah, absolutely.
And then can drugs and alcohol cause bipolar disorder? Or I know that it can impact it, but can it cause it in any way?
It's not an actual cause of it, at least that studies have shown, as I mentioned earlier. It's definitely something that you have to avoid if you're dealing with bipolar disorder, and I would extend that to just about every mental illness that is possible, right?
Yeah.
Alcohol, drugs, the effects that they have on the body. Sometimes you'll see drug use actually trigger or contribute to the triggering of an episode. Cocaine is a very high stimulant. Alcohol is a depressant, and so you can see how those correlate with, you're already prone to one extreme or the other, and if you add these chemicals into the mix, it's not a good outcome.
Now, when we're talking about bipolar disorder symptoms, are they hard to sort of identify in children and teens? Because I know, like, especially teens, you know, you get into those years where there's ups and downs and there's kind of those teen mood swings. Is it hard for a parent to sometimes tell?
Yeah, exactly. And so as most of us know, right, as your child is going through puberty, as you mentioned, you have these mood swings. You have one day, Mom, I hate you, and the next day is, Mom, I love you so much. And it's just like, what's going on here? And so that can kind of mask if there's a true bipolar disorder that is present. And so that's why it's harder to make that diagnosis of bipolar disorder in those early years, those formative years. So yeah, definitely.
What's the youngest age that you've seen personally with bipolar disorder?
In my personal experience, it's been teenagers. I don't remember if it was 13, 14-year-old.
Okay.
I can't recall dealing with someone under the age of 12 who's actually been diagnosed with bipolar disorder.
Mm-hmm. And you talked about the complications, because I think it's really important to understand. If you do not treat the condition, you will be dealing with potential problems related to drug and alcohol misuse. So you're most likely to turn to those. And I assume it's when you're in a high, you're trying to get low, and when you're low, you're trying to get high, kind of thing. Or is it?
Well, some people actually are even trying to extend the high, if you will.
Okay.
One of the things that I mentioned that is commonly abused is sleeping medications, for example.
Oh, wow.
And so if you've gone 72 hours with no sleep, you're looking for some way, like you're tired of being up nonstop. And so you're looking for something. And yeah, it's self-medication. You look to alcohol, you look to the sleeping meds, you look to those to try to balance out what even you're picking up on some level is not right, not normal.
Yeah, and then the suicidal ideation and suicide attempts are also, so that is something that we talk about, and making sure that you call the 988 line whenever you're in that state. But then we also talk about the other issues that you may face. So because you aren't able to live your day-to-day life, you may have legal or financial problems. So you may get some road rage, let's say, on the road, and there goes that legal issue. Or you may not be able to hold down a job because you're not able to regulate yourself and live the day-to-day 8 to 5 job, so to speak.
Yeah, the effects of untreated bipolar disorder can just impact a person's life in so many different ways. And you typically will see somebody who, if they have gone untreated, something is going to bring them to a boiling point, if you will, or they're going to hit rock bottom, and they're going to be put in a position where there's no other option but to get crisis help.
Now, when it comes to physical conditions, you'll hear about sort of comorbidities that exist. So you'll have maybe high blood pressure, and you're also dealing with high cholesterol and diabetes, let's say. With bipolar disorder, can you have bipolar disorder and have an eating disorder, let's say, or have anxiety or another issue that may also complicate your treatment? Oh,
absolutely, yeah. And you'll see that there's a lot of anxiety associated with bipolar disorder. Eating disorders, think about depression, for an example. Some people stop eating completely, some completely binge eat, overeat. And so that can lead to other complications related to that. So the eating disorder kicks in. PTSD, you might have, in addition to your bipolar disorder, had some kind of a stressful event that led to you having this post-traumatic stress disorder. So a huge trauma in your life, and trying to deal with both of those things can be even more difficult.
Now, when we're talking about the mania and hypomania, for instance, you talked about having 3 or more of the symptoms. So so if you have one where you're just, let's say you're unusually talkative and always talk fast, like myself, then, you know, but you have to make sure that you're paying attention, that you're repeatedly seeing those 3 that you're experiencing.
Right, and that's from a diagnostic point of view, that's how they determine that you have actually, you know, that's how they classify you as having that. So it's based on number of studies, research, et cetera, over the years. Yeah.
And for how long are you supposed to be having them, just to remind? So if you've been experiencing this for how long Would it be, is
Well,
a time period involved?
Yeah, so again, it depends. Like if you're talking about, the word escaped me, I'm so sorry. You're talking about like if you have them for the majority of the day, every day or almost every day over a period of time, yeah, then that's when it says, okay, this meets the criteria for this. Yeah.
And then for obviously the major depressive situation, that would be 5 or more of the symptoms. So that's a little bit, that has a little bit more that you have to show you've had those for longer periods of time.
Right. And some people who maybe the depressive symptoms stick out, but the mania kind of doesn't, maybe it's just a hypomania, they could just think, maybe I'm just major depressive disorder, right? Maybe I'm just always depressed, and they're not picking up on the flip side to that, which would actually put them into a bipolar category versus just depression.
Now, what is a mixed episode?
Mixed episode is when you're actually experiencing kind of both symptoms from both.
Simultaneously,
so,
you can kind of be living with both.
Right.
Do you ever experience patients with that mixed episode?
We do. Typically, when they're in crisis, we're seeing one extreme or the other, but we do get patients in that are experiencing. And you can imagine how confusing that is for an individual because they don't know what it's coming at them from all directions, you know.
Now, obviously, when you're talking about bipolar disorder and you're the person with it and you're living with it, do you recognize? Can you actually not recognize that you're in a that you're in a manic or depressive state, and where somebody else may be like, you're definitely in one?
Yeah, and having talked to patients dealing with it, in my experience, they usually recognize when they're in that depressive state, right? It's kind of hard to overlook the fact that you just don't have the energy to get out of bed, to do the things that normally make you happy, to interact with others, etc. The suicidal thoughts coming in. But when it comes to the mania, again, sometimes it feels really good to the individual and they just don't want to admit that it's, you know, or maybe not even recognize. It's just, I feel great, I feel awesome. When psychosis, delusions, hallucinations enter the picture, then there's been a little bit more of a break from reality, and so then they're probably not going to realize that at that point they've crossed over to that manic episode.
Do those individuals with bipolar disorder know the impact that they have on others, that they have on others when it is untreated? Do you think they understand?
It's a hard question to answer, honestly. I think sometimes they do. I have in the past had patients come back and apologize once they've stabilized for behaviors that they exhibited when they first started treatment. But there are others who have absolutely no recollection, at least claim to have no recollection of what they did when they were in that really severe state.
Now, you talked about people in the euphoric state really enjoying being in that state, and they think they want to be there all the time, but what goes up must come down, right? So will there always be a crash?
Not always. You're not always going to see a crash. Sometimes they'll cycle up and then they'll go back into that kind of normal phase for them again, right? And it's not a guarantee that you're going to automatically what goes up must go all the way crashing down.
Now, with the diagnosis, what is the first step for somebody to be diagnosed with it? Do they come into the hospital and work or go see their doctor, a therapist? What's the first step for somebody to be able to get a diagnosis? Right,
it would be an initial psychiatric evaluation. Ideally with a psychiatrist. I mean, your family doctor or something could probably start that process. There is a questionnaire that's been designed that kind of helps pick up and help aid in that diagnosis. Unfortunately, like other mental illnesses, there is no blood test. There is no scan that they can do automatically to say, oh, yep, you came back positive, you're bipolar. So it's based on a description of the symptoms that they are experiencing. And the doctor is going to make that determination based on well-established criteria that have been already put forth. There's a DSM is a manual that is used to help define those criteria for bipolar and other mental illnesses.
Now, there are a lot of resources online, obviously, when it comes to mental health. NAMI's website, Psychology Today, places like that, where you can go, and they do have these online sort of tests that you can take.
Yeah.
And I know the Psychology Today one is one that I found online, and it had like 20 questions where you agree, disagree. It's sort of got a range. Like, I occasionally feel so good or so amped up that people tell me I don't seem like myself. Is that something that you completely disagree with or agree with? Do you find that these are helpful for people to at least start noticing the issues, and then they can come and obviously speak with a professional?
They can be a really helpful tool to get somebody in the right direction towards seeking help. The caveat to using those types of self-examinations is you have to answer them truthfully.
Yes.
You can't go in and undersell what you're experiencing. You're not going to get an accurate answer unless you're completely honest with yourself when you answer those questions. So if you go in with an open mind and say, I have some concerns, I think I might be bipolar, I'm going to answer these questions truthfully. And then if the answer is saying, yep, you should probably consider seeking help, then you go in and again, be completely honest with that doctor or that therapist or whoever it is that you're having that initial contact with, so that they can help steer you in the right direction as well.
But honesty is the best policy, even whether you're taking an online survey or quiz or whether you are speaking with your healthcare professional. You have to be completely honest and upfront, because I know we hear about it in physical health as well, where you're like, oh no, I eat well, or no, I exercise. But if they're like, I don't see that in your numbers, so you really have to be honest.
Right, and that's one of the biggest differences between dealing with physical ailments and dealing with mental health issues is, I can go in and have some labs drawn before I go see the doctor. The doctor's looking at these results and saying, so how much fried food do you eat? And then are you eating red meat every single day, every meal? And you're like, no, doc, every once in a while. Well, your cholesterol's through the roof, right?
Yeah.
So there's something that's going to tell the doctor, we need to narrow down what's causing this.
Yeah.
In mental health, it's based on, what are you telling me that you're experiencing? What are you dealing with? I mean, if you have a friend or a loved one who knows you and can also tell the doctor, well, but typically that's not going to happen. It's going to be based on, as you mentioned, honesty is so very important.
And now with the treatment option, so obviously there's the medications, and we talked about those, and then there's the psychotherapy. So being able to talk with a licensed professional about the issues, and they always involve a mix of the two.
Yes, and so the most successful treatment for bipolar disorder over the span of someone's lifetime is a combination of medication and therapy.
And then learning, obviously, self-management strategies.
Yeah.
So ways to educate and identify the early symptoms of an episode, avoiding triggers, things like that. And that is something that a professional can help you with.
Yes, definitely. And it applies to bipolar disorder as well as any other mental illness, any other disease in general. Educating yourself on that disease process, educating yourself on what causes it, how do you manage it, what can happen if you don't, etc. That's the best way to learn how to live with something like this.
Are there any side effects with the medication? Because I know there's always, people worry about taking medication. Is there any sort of side effect that any common ones?
As with any medication out there, there's always going to be potential for side effects. One of the common mood stabilizers that people hear associated with bipolar disorder is lithium. And so you have to be careful to have your lithium levels checked, because you don't want to become what they call lithium toxicity, which is the bloodstream, or the levels in your bloodstream are higher, and that can lead to some very, very severe symptoms, including up to death. But by keeping on top of that with your lab work and seeing your doctor on a regular basis, adjustments can be made if they need to. And if you're exhibiting signs where you can't tolerate the lithium no matter what dose they've got you on, there are other options for mood stabilizers as well. Yeah.
So you're diagnosed with bipolar disorder. You need to be making lifestyle changes to help with bipolar disorder, right? So quitting drinking alcohol and or using recreational drugs and tobacco is a no-no. You got to make sure you don't use any of those.
Yeah, I mean, the standard is abstain from everything, especially with some of the medications. Alcohol can be a very dangerous interaction with the medications. But even in the absence of medications, as we mentioned earlier, those substances can lead to some very serious consequences with bipolar disorder.
And you mentioned this as well. Keep a daily diary or a mood chart. And it's really good because you may not remember. And I know the more organized you are when you come and see your therapist and you have a chart that shows, okay, I had this many lows, this many highs, or whatever it may be, you're able to discuss that and more openly and honestly. But if you don't really understand, oh, maybe I did or not. So keeping that diary is very helpful.
I think the inclination for most of us, right, is to undersell again what is happening. So if I come in without some kind of a chart to reference and the doctor or therapist asks me, so let's talk about the last 3 weeks. What do you feel like your mood was? Oh, I had that one day I got upset at Walmart because the guy cut in front of me in line, but other than that, I was pretty stable. But you have that chart and you're honestly answering and filling out that chart, you can say, well, I can see, yep, there's this trend where I started to really stop caring about stuff. I started sleeping a little bit later. I started eating less. I didn't do my usual workout routine, etc. And so they can help you even identify you might be headed towards, an extreme, a high or a low.
Another lifestyle change or tip is maintaining a healthy sleep schedule. Sleep is essential to life.
Yes.
Like we need our bodies need to rest, and so if we're not sleeping properly, it can have an impact on whether we have a condition or not.
Oh, definitely. I could probably spend a whole session, one of these Let's Talk series, just talking about the symptoms I've seen from patients who have gone without sleep for extended periods of time. It is so amazing how we have to have sleep to function and how we can quickly lose touch with reality when we don't get the sleep that we need. And I think all of us can have experienced times where we just couldn't sleep due to maybe we have a cold or the flu or something, whatever, but not having that sleep, man, it really makes a difference. And so when you have a mental illness, having that adequate amount of sleep every night is crucial. I mean, it's such an important part of managing your illness.
And then exercise. And exercise also is essential. Obviously, it helps you maintain a healthy weight, but it also, for your mental health, is really great for you as well.
Yeah, and so you hear people talk about with exercise and your body releases endorphins, and so it helps regulate your mood better. Your physical health directly impacts your mental health. Mental health conversely impacts your physical health. And so if you break that relationship cycle there, then you're going to have something that's going to go awry, whether it's physically, mentally, probably both, right? So having some form of routine exercise, and it doesn't have to be, I know we mentioned jogging and running and bicycling. If you don't feel like you're in the physical condition to do something as strenuous, even something as simple as walking around the block every night or something like that can make a huge difference.
Or trying some yoga, some simple yoga. You don't have to like go into downward dog in the first day. You can sort of ease into it and do what you can do, but even the mindfulness, the breathing techniques, things like that will help you.
Yeah.
It's still good exercise. And then managing stress is always really important because I know that we all lead busy lives. There's a lot of stress in there, but managing that stress is important. But the other one that I think is key is maintaining healthy relationships. And I think that one can be really hard, especially if a family member, let's say, is a trigger. But sometimes you may have to cut people out of your life just because you need to maintain healthy relationships.
Yeah, and it sometimes is a hard reality, a harsh reality that someone has to face, is that this person is a huge trigger, and sometimes you have to make the right choice for yourself to help manage, whether it's bipolar disorder, even if you're not bipolar, right? But that's where therapy can come into play such a big role in dealing with this. The family therapy, the couples therapy that I mentioned earlier, you can start trying to work on those issues and identify them, because sometimes you may not even know. You may have a love-hate relationship with an individual where you feel like you can't be without them, but they're actually a really bad influence for you.
Now, here are some tips for living with bipolar disorder, which you can hopefully expand on. So get involved in your treatment. You are part of your treatment plan. You should be actively involved in your treatment.
100%. I always cringe when I hear about a patient saying, well, this is the medication the doctor gave me. I don't know what it is, but I'm taking it. You should know what you're taking. You should never be afraid to ask your doctor questions if you don't understand something. You should, again, educate yourself about the illness, about the medications, about the therapy, about everything. You need to be actively involved in the treatment for it to be most effective.
And you have to be patient with yourself. You have to give yourself grace when it comes to living with a mental health condition like bipolar disorder. You can be doing everything you need to do and may just have a slip, and it's going to happen.
Yeah, and it's okay. And a lot of times you can compare it to like people who are dealing with addiction of some kind, right? You have a slip, you fall off the wagon, etc. You can't just beat yourself up and say, I'm a failure, it's never going to work. Same applies to bipolar disorder, dealing with any other mental illness. You're going to have those setbacks. You're going to have that day where you didn't take your medication, or you forgot to do something in your routine, for example. You just get back up and you start again, and you say it's the big picture. It's the long haul. It's not one day, one setback.
And then monitor your symptoms and your moods, knowing your triggers and the early warning signs.
For sure. And again, every individual is different, whether they have an illness or not. And so knowing those situations that might be a trigger for you, knowing those situations where, it's better if I don't even go to this get together, because I know that there's going to be some people there that really like to drink heavily and get out of control, and that's just going to get me into a bad spot, right? So, that's one example of knowing yourself, knowing your limitations, knowing your strengths, and trying to steer yourself in the right direction.
And as you mentioned, you know your warning signs, but you also have to act on those warning signs, avoiding that party because you know someone is going to be there, or whatever that situation may be.
Yeah, versus saying, well, I'm going to go to this party and I'm just going to warn them. I'm not going to be responsible for what happens after I have 10 drinks or whatever. So that's not a good idea. Better to avoid that altogether.
How important is it to have an emergency action plan? So you're starting to see the symptoms. Can you create an action plan for yourself to deal with it, to know?
You can, and you can actually work with your healthcare provider, your healthcare team. If you're seeing for example, if you're seeing a psychiatrist, a mental health professional, you're seeing a therapist, you can work with them so that if something happens, what am I going to do? Do I need to reach out to you? Do I need to reach out to the hospital? If possible, having a support person that is a big part of your life who also recognizes those symptoms may be able to enact that on your behalf because you may not recognize it's happening. But yeah, that is a very important thing.
Is there a tendency to isolate yourself when you have bipolar disorder, and therefore people around you may not be able to be there to help? As you say, you need to have a support system that can help catch you when you're falling. Right. But do people tend to isolate?
Especially when they're in the depressive phase, right? They probably are not going to want to be around people. They're probably not going to want to even get out of bed or get out of the house or deal with anything. And so having those contacts, even if it's somebody they check up on you every day, they text you, send you or give you a quick phone call, hey, just checking in. You don't answer, that would be like, okay, I'm gonna drive over there and check on them, so that would be a huge help, yeah.
And then why is it so important to develop an active daily routine?
Well, when you have this routine, you know that I've got step one, I get out of bed and I put a pot of coffee on, and then I'll take a shower, get out of the shower, the coffee's ready, I'll make my coffee, get it ready to go, et cetera, throughout your day. So you've got steps, and it just keeps you focused on moving on to the next thing, moving on to the next thing. It's kind of like when you make goals and you set those small, reachable goals. Having an active daily routine is the same kind of concept, right? Where you plug through everything and you go from step 1 to 2 to 3, et cetera, and it keeps you moving and it keeps you focused on getting through the day without starting to worry about some of those larger, bigger picture things that could easily lead you to like, nah, now it's not even worth getting out of the house because what if I got to deal with this? So it just keeps you kind of focused on moving in the right direction.
Now, you had a great slide on how to support an individual who may have bipolar disorder. Let's go through some of those highlights again, just to make sure that people caught on to that. So obviously being open about bipolar disorder with them, having conversations and really understanding it, and educating yourself about bipolar disorder so that you understand your loved one. Right,
and so just as the individual dealing with the bipolar disorder needs to be educated on it, so do those who plan to support them. You can't support somebody if you don't know what they're dealing with, right? You may not be able to exactly understand what they're feeling, what they're going through, but you know what the symptoms are. You know what the warning signs are. You know what the treatments are for that. And so you can, sometimes it's just a gentle reminder from someone like, hey, you know, you really need to take your medication, or hey, you really need to avoid this situation. That helps remind them why it's important for them to do that.
And you need to learn their triggers as well, because you're going to be able to help them avoid situations. If you can sort of be the police of the situation.
Right, and so sometimes it's easier to point out everybody else's flaws but your own, right? It's kind of same concept, and so you probably will not recognize some of the warning signs as a person with bipolar disorder, but your best friend or your wife or your sister or whoever is going to say, you know what, Kevin, you're already starting to show this and this. I'm a little concerned about it. Do you want to talk about it? And you can't be judgmental when you're doing it. You can't say, you're already doing this, so you need to get help, or I'm not going to put up with this. That's just going to put them in defensive mode, and then it's not going to go well, right? And so you have to say, hey, you know, let's talk about this because I'm picking up signs. I'm not going to talk about it right now. Okay, well, I'm here when you're ready. I mean, you have to be supportive.
And you have to be able to talk about behaviors that you find challenging. So you may notice some things. You have to be able to have those open and honest conversations.
Right, and so depending on the symptoms that an individual might be showing, you can't beat around the bush and you can't say, well, I'm not going to talk about that one thing because that's uncomfortable. If support means 100%, right?
And avoid making any assumptions.
Absolutely.
It's better to ask than assume.
Right. Yeah, you can't say, hey, I saw you doing this, and so I know that you're entering one of your phases, right? And it could have been they just had something happen at work that would have made anybody upset in that situation, but they're going to be able to work through it with the coping skills that they've worked on with therapy and stuff. So better to open up and say, hey, what happened? I noticed that you're doing this, and let's talk about it.
And lastly, make sure that you look after yourself as well, because it's something that I think happens a lot with caregivers. They get so consumed by caring for someone else that they neglect themselves, and then their own physical and mental health is challenged.
Yeah, caregiver burnout is a real thing, and you can focus so much of your energy and your attention on the person that you're worried about, you neglect your own. And if that happens, then who's going to be the lookout for that person that you care about, right? So you have to self-care, take time for yourself. You have to also balance as best as you can, you know, find additional support to help you so that you can get away for a while.
And now, when should a person with bipolar disorder seek professional help? As soon as you start noticing those warning signs that you spoke of on both the highs and the lows, the mania and the depression?
Yeah, if someone has bipolar disorder that's already been diagnosed and they've already established treatment with a psychiatrist, with a therapist, etc., then knowing those warning signs, and again, going back to education and knowing yourself, you should already have established with them, when do I need to contact you? When do I need to call your office and say, I probably need to come in sooner, can you squeeze me in? Someone with bipolar disorder who has not established those relationships, or even severed relationships because they just stopped going to appointments. When they see that those warning signs are starting to happen, they need to set up an appointment. And unfortunately, patients who have stopped going to the doctor are a lot of times going to be treated as if it's a new patient, and so it's going to be harder to get in to see them. If it's getting to the point where you or your support system are concerned that this could quickly spiral out of control, you can call us. I mean, even if you don't meet the criteria necessarily for inpatient treatment, you can at least assure yourself that you're not at that point. And oftentimes we can work with you to try to get you an appointment with someone on an outpatient basis sooner than you might be able to on your own.
And when should you seek emergency help?
If you are, obviously, as we mentioned, suicidal thoughts, you are feeling so hopeless that you are willing to do whatever it takes to end your own life, that is an immediate, no hands down emergency. If you are the opposite of that, where you're in a manic phase, you're probably not going to have the presence of mind to look for help on your own. That's where that support system would come in handy, because if you are putting yourself in harm's way, you have no regard for your own safety, you are homicidal towards, I'm going to kill somebody else, and you really mean that you're going to do it, you are so aggressive that you're hurting other people or potentially going to do that, then the person is probably not going to voluntarily seek help on their own. If they do, great, they can come to us or to any inpatient hospital and present for an evaluation. But a lot of times, unfortunately, someone in a manic state that is not aware of what's going on is going to end up with law enforcement involved, and then they're going to kind of make the decision for them that they're going to get evaluated.
All right. Well, thank you so much, Kevin. We really appreciate your time. This has all been very enlightening and educational, and I hope that it has been very beneficial for everyone watching as well.
I hope so too. Thank you very much for having me.
Thank you. And that officially concludes our webinar. We thank you for watching. We hope you'll continue to prioritize your mental health and the mental health of your loved ones. If you're experiencing mental health challenges, SCHS Behavioral can help. The facility has served the South Texas community for more than 30 years, offering inpatient and outpatient treatment options. If you or a loved one is experiencing a mental health issue, you can schedule a confidential assessment by calling the hotline at 388-1300. Please remember, you are not alone. Speak with a loved one or seek professional help if you need emotional or mental health support. And if you are experiencing a mental health crisis, please call the National Suicide and Crisis Line at 988. Licensed counselors are available to speak with you in English and Spanish 24 hours a day, 7 days a week. Now, don't miss our next installment of this Let's Talk Mental Health series on Thursday, April 3rd at 5:30 p.m. live via Facebook, when we'll discuss faith in the face of adversity. We hope you can join us. Watch for previous mental health webinars at sthsletstalk.com. Until our next seminar, please stay healthy, stay safe, and continue to prioritize your mental well-being. Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority.